They said, oh, we're just going to do a follow-up regarding your test results. Once they brought us back out, they were like, okay, so we actually did find something wrong with the baby. My heart just dropped. I was like, oh man, like what could be wrong? What could be wrong?
Baby Abraham had a condition called gastroschisis, which is a condition where your intestines are outside of your body at birth. Obviously, having your intestines on the outside of your body is very shocking to anybody who's not used to seeing something like that.
This is a frightening diagnosis, frightening bit of knowledge to be told that your baby would have this type of a problem. For this couple, I'm sure that they were walking on a razor's edge throughout the whole pregnancy.
I told myself that I had to be strong for not only for Abraham, but I also had Addison at home.
For the lack of a continuous monitoring, a problem can develop intrauterine before the baby's delivered. The baby could have died. The mother knowing that, and with that kind of fear, yes, the patient requires a lot of emotional support, a lot of hand-holding, reassurances.
I just told myself I needed to be a support system to her, especially because she was hurting the most, so it's like I needed to be there whenever she needed me. And I told her, he needs you more than anything else. I just had to be strong, especially for them.
We can cover and we can take care of many of the neonatal problems we experience in the NICU. So most of the operations that we need to do on babies, we can do right here in this hospital.
Abraham was delivered in the morning and by noontime out of surgery and doing well. And after appropriate time in the hospital, was sent home. As far as I know, the kid's a gurgling, growing little boy that's doing extremely well.
I remember Abraham during that time. He's one of the bigger babies that we have. I will always remember him. He doesn't really cry a lot. Also, the parents are very nice. They're very kind. They come, they talk to everyone, they say hi to everyone. It's very uplifting to be able to serve our neighbors who doesn't have a lot in the world. We give them the care that gives them back their dignity. I think that's one of the things that I like working here.
Since I stayed here at California and Abraham stayed here at California, like everything just worked out so smooth, like better than what we had expected.
It's just so amazing how it went from him being in a NICU with all these IVs and tubes and everything, and it's really amazing. It's like a miracle. And to be able to bring him home, and his grandparents were like unexpected. It's amazing.
While we have the tools we need to take care of all the babies here in the NICU, having more space to allow us to take care of more babies, having space to do some of these procedures in the neonatology unit without having to partition off large sections of it is all very valuable and makes everybody's job easier in terms of caring for these children.
Here at California Hospital, we're so proud to have some of the most dedicated and highly skilled physicians and staff. They give so freely of their time to make sure that our patients are treated with dignity, with the quality care that they deserve. California Hospital Medical Center has been in downtown Los Angeles for 131 years and will continue to be the center of health and wellness for the communities we serve. California Hospital Medical Center is building a 4-story patient care tower to begin the process of modernizing this campus. This new building will offer us new medical technology and a more medically efficient layout. It will also offer expanded and enhanced maternity services.
Our patient population in trauma have increased by 40 to 45% from the day we started trauma about 11 years ago. Not just in trauma, but for the rest of the emergency room patient that we are serving.
And now we're up into the low 80s, about 82, 83,000 patients a year, which is a very high number of patients to be seeing in a small emergency room. Anyone from 1 day of age to 105 years of age, any ethnicity, socioeconomic class, regardless of the injury pattern or illness, we're here to serve the community and take care of everybody.
Dignity Health wholeheartedly believes and supports this expansion. We know that the care and well-being of everyone who lives and works in downtown Los Angeles depends on a state-of-the-art hospital.